So welcome everybody. Great to see everyone. These are our bi-weekly town hall meetings to try to keep people up to date on what's happening with monkeypox, or MPX as we're starting to call it. So why don't we start with, of course, the question is always vaccines, vaccines, vaccines. So why don't we start with our lovely county people, and they can give us an update on where that stands.
All right. Hi, Jeff. It's Misty Plumley. I'm the branch chief over emergency response, family planning, and immunizations with RUHS Public Health, supporting the public health team here on the line. So vaccine-wise, California was afforded its 3B and 3C phase allocations for vaccine doses. Vaccines have been previously allocated in phases based upon orders from the California Department of Public Health through to the federal government. Vaccines continue to be accessed through the Strategic National Stockpile, which is a federal mutual aid resource. Vaccines have been accessed through this pathway since we started these meetings, and will likely continue being accessed in this manner throughout the rest of 2022 and the foreseeable future. The allocations for vaccine continue to take into account current case data in a particular jurisdiction or region or state as a whole, and then also elements related to population density, risk population that is affected by the current case profile, and upcoming events are factored into requests for allocation as best as CDPH or CDC can manage. Riverside University Health System Public Health received their phase 3B plus 3C allocation threshold of 690 vials of vaccine, and we are to utilize the intradermal dose maximizing strategy for patients that are 18 and older who meet eligibility criteria for the intradermal vaccination route. There are specific medical conditions we consider, and then patient age factors in. The vaccine is currently available for individuals aged 0 and older. Pediatric patients or kids between the ages of 0 and 17 receive a subcutaneous dose of vaccine, and then adults that are 18 plus meet the criteria would get an intradermal dose of 0.1 mLs, which does allow for a more concentrated, more efficient dosing strategy to maximize what we do have. The current operational assumption is that each vial of vaccine should theoretically hold 5 doses of vaccine, which would take 690 vials to 3,450 doses. Riverside County requested that allocation threshold and received it today. We will process it into inventory, and our current strategy has been to disperse 75% of our allocation out to providers. We do work with larger scale event planning and try to also take into account with our vaccine providers when they may be running extra clinics to try to support with additional doses. We did do an allocation to providers today to support their ongoing operations with the intradermal and subcutaneous strategy as outlined. And we also submitted a request for an additional 2,000 doses of vaccine to support upcoming Pride-focused events September 4 and October 1, as well as leaning forward to prepare for other events upcoming in November. Additionally, with vaccine, the CDC announced a large event pilot program that was focused on events that would have 50,000 attendees or more, and requested strategic planning around those particular events, dates, attendees, and strategies for vaccination. Riverside County submitted applications for events to focus on clinic series for Inland Empire Pride Festival, Idlewild Pride Festival, Weather Pride, as well as Palm Springs Pride, requesting over 50,000 doses of vaccine. Sorry, I'm getting a lot of background noise there, Jeff. Pause for a minute.
No worries. Stephen, I think it's Robin Bishop. Yeah. Thank you.
Thanks.
Go ahead.
So we submitted applications for those larger scale events in partnership with CDPH and other health jurisdictions to try to combine an aggregate request for multiple vaccine doses to support larger scale events throughout the upcoming months. We've been advised that those applications have been received, the plans reviewed, and alongside other submissions from other local health jurisdictions will be submitted over to CDC to be considered for this large event pilot process. I do not have any adjudication update for either the 2,000 extra dose request or the larger event applications, both of which having been submitted the tail end of last week into early this week. With the vaccine allocations, we anticipate, though cannot confirm or completely predict, weekly or bi-weekly allocations that will continue with federal government to state government support. And those allocations will continue, as I mentioned, with the Strategic National Stockpile. It is important to continue to re-emphasize that Los Angeles County, due to its population density and size overall, will continue to receive allocations directly from CDC. CDC did also open up pathways for other service groups, federally qualified health clinics, Ryan White Act funded clinics, and tribal nations to support vaccine ordering directly through federal channels so that those partners can be served as well, and ideally doses maximized to risk populations that may be underserved, under-accessed, or at higher risk for severe MPX illness or potential hospitalization related to MPX. With the vaccine allocations through CDC, those would be up to individual partners to apply for based on the funding streams that they receive and how they are navigated. And we will continue vaccine distributions throughout this week to continue to support the providers. I think that covers the higher level summary update with what we've done and what I know. I'm happy to take questions, or Dr. Shavinsky may want to add.
I can add maybe a couple things onto that. I have a broader update, not vaccine related, but in terms of the vaccine, one point that I want to mention or sort of explain. Misty mentioned that each vial is anticipated to get the 5 doses. But just to share on that we have heard back from partners that it's closer to 4 doses or so that they're getting from each vial because of having to pull up the amount and the potential for little bits of waste. So we are not anticipating that we will be able to get the full 3,450 doses out of the 690 vials. 1, because of that, and then 2, because of the pediatric potential vaccines, as well as the keloiding. So while it's up to 5, likely we will not be seeing that full potential. Second, I just wanted to add on that is while the thought has been switching to intradermal means that now we have full relief of and enough vaccine. I just want to make sure that it's understood that that's not entirely the case, because with the switch to intradermal also came a switch from CDC allocating based off of doses instead of vials, which means less number of vials coming down to the state, and also means less number of vials coming down to us. So as you heard, the 690 vials, that is a combined phase, 2 phases together. So it's less vials than perhaps we otherwise would have anticipated, but in effect, more doses because of that anticipated expansion. But we're not in a situation where we're seeing that we now have a plethora of doses. It's still limited because of that chain of CDC, then limiting because of switch to intradermal, and that trickles down to the state. That also trickles down to us as well. And then also wanted to just add that we continue to move people off the vaccine interest form. So we've been scheduling those appointments for those that meet the criteria as well, to move people off the vaccine interest form and to get people into vaccine slots. So just wanted to add that part, and then I'll hold off on the other updates that are not as vaccine focused for now, so that way questions can be answered.
Great, thank you so much. And speaking of questions, John Taylor has his hand up. Go ahead, John.
I must report that, can you see a little red splotch? I'm vaccinated thanks to Los Angeles. Last Friday, St. John's Health in South Central had 600 people vaccinated before lunch and did it very efficiently. My question is, over the weekend, Charlotte Pride was one of the first of those sort of emergency big event vaccinations that they had 2,000 doses in arms, according to news reports. It seems to me like we should be vaccinating everybody who is going to be participating, working in hotels, working at resorts, working at restaurants in this town, like next week, so that they can have their second shot, they can have their 2 weeks beyond that, and they can have 100% or close as vaccines allow protection. It seems like doing it, if we're going to get 50,000 vials, or doses, that would be awesome. But it would seem like the horse is already out of the barn and we're chasing it down the road to vaccinate it. I guess those aren't questions.
No, but it's a great point. I think it's a great point that, and that's, what our feeling has been too, is, the pilot is one arm, but if that's coming at the time of Pride events, that's not necessarily soon enough to provide maximum protection. We know that maximum protection doesn't come from one dose, but comes from 2 doses plus 2 weeks, which is why we're asking for additional allocations above what we have, because we know the best chance of getting people protected means getting more vaccines to be able to put it into people's arms now, or, within the next couple weeks. The closer we get to Pride, the less opportunity for higher levels of protection that we have. So I think it's a good point to point out that challenge. As you mentioned that you got your vaccine in LA, we know that they're getting larger allocations, which means that they're able to have larger events. And, similarly, the information that we have given with the CDC pilot, and then also for the 2,000 doses has been, if you give us the doses, we have great partners, and we know that the community is very willing to get the vaccines. There isn't the hesitancy that we're facing. If we have the doses, we can move them out. And so that's what our, we continue to, and not just us, but we've heard, from CDPH and from others that they're hearing from members of the community too. So we're reiterating that we have a good partnership here between public health and the community, that if we have the doses, we can get them in arms quickly.
Yeah,
there are 261 cases in the entire state of North Carolina, and they got 2,000 doses for Charlotte Pride, which is not as big as Palm Springs Pride. I know, I'm just, we're all on the same page, and I'm just preaching to the choir.
Yeah, these decisions, as Dr. Tavensky was saying, are made at the state and the CDC level. So now might be a good time to hear from the state, the California Department of Public Health. I think, is that Marissa who's going to be speaking? All right, I think Tiffany is on as well, but whoever wants to unmute and kind of give your update from the CDPH.
I don't think my update's any different from the county. We have received more vaccines. We are shipping them out to the counties, and it's based on the same formula as before. And there will be another shipment coming sometime in September But like the county has said, they've switched over to doses instead of vials. So it's not more vials we're getting. So it's the same amount as we've been getting. And hopefully in September, we get more.
Mhm.
The other thing that has happened, though, there is the HRSA is now sending directly to Ryan White Part C clinics their own supply of vaccines. And so I believe DAP said it last week that they are part of that. And I believe there's no other Part C clinics in Riverside. But just to think about the difference between Los Angeles has, I believe, 6 sites that are also Part C that perhaps might be getting those vaccines or not. We don't have that information of how many, nor do we know which clinics are participating yet.
Yeah, great, thank you. You're right, the DAP is the only Ryan White Part C clinic in the valley, but there are several in Riverside County, I believe, and San Bernardino, because it's a joint TGA through the Ryan White program. On past calls, I know when Dr. Aragon was on last time, and I know Dr. Chavinsky has talked about this, there's a 15% of the overall statewide allocation that is discretionary. And I know that our public health department at the county has been making these requests, and they'll request several hundred and get a few dozen, specifically for these kind of vaccination events that we've been talking about. So can you tell us where that stands and why we're not getting more out of that allocation?
I actually
address this
need, I need to check with the immunization branch on that. I'm not sure if it's 15% still, or was that at the beginning? So I don't want to say it is and it's not.
Yeah.
So
and the other,
yeah.
sure,
yeah.
no, I understand. And it's hard to put you on the spot because you don't make these decisions. But the other issue is, and if you could relay this to Dr. Aragon, is that there have been direct appeals to him describing the situation in Palm Springs, why we are that we are a sex tourism destination, and we're like not Palm Springs, but Provincetown and Fire Island, which early on, before July 4th, had big vaccination events, just like John was describing for Charlotte Pride, and got lots of people vaccinated, and they did not turn into super spreader events. And so, we've been making that argument and we haven't gotten any response. The mayor, several of our elected officials, people from DAP have all approached Dr. Aragon and publicly requested this and have not gotten a response. So again, not to put you on the spot, that wouldn't be fair, but please relay that to him. We need him to come on these calls, and he needs to address these issues to our community, because there's going to be a lot of suffering and a lot of hurt if we don't start getting vaccines in arms now. And this, the state has some discretionary power to do this, and we need them to exercise that. And certainly talk to those jurisdictions to see how they did it, appeal to the CDC for more if they need to, but we need, our public health officials at the state level to be advocating for us just as effectively as our local county officials have.
I hear you, and I will relay the message to Dr. Aragon.
Great, thank you. Step off my soapbox and Dr. Ritchie, go ahead.
Yeah, this is for CDPH. So we've been in a state of emergency for monkeypox for, I don't know, 2 weeks. And it doesn't seem like any funding's coming from that at all. Have I missed something? Is there funding? I've gotten emails from Gilead and Viv about funding, but not from CDPH. And again, testing is expensive, and it'd be great to have some resources from CDPH. I asked Dr. Aragon, let's see, about a week ago, and he said that you're in talks, but I mean, it just seems like everything is moving very slowly, and it seems like it should move faster in my mind.
I don't have more information than what he stated last week at the listening session. We are still waiting.
What are you waiting for?
I money to be allocated if it is. We
Maybe
don't, we don't allocate the money. So Department of Finance has to allocate it. They have to get approved by the governor. We don't have the funding. In fact, our department is mostly federally funded, and it goes with different programs. So we
with the
are
federal-
waiting.
So yeah, as a follow-up to that, there's a federal declaration of emergency as well. So has that translated into more available funds to state departments like yours?
No, not yet.
Another advocacy issue, I guess. Kim, go ahead.
Yeah, just wanted to echo what Marissa said. So we have been tracking very closely the 38.5 million that Senator Weiner has proposed for emergency monkeypox funding. But as Marissa stated, it has to go through the process. So this is where advocacy can really help, right? Letting people know that it's important that that funding gets out. And CDPH, it can't do that. They are not allowed to do that. We can't advocate to legislatures to allocate funding to us. So that's where the partnership really comes in. But it is stuck there in the legislature. And for the feds, I checked again this afternoon to see if there's any new information. There's nothing new coming down in terms of funding, which I hear you, Dr. Ritchie, loud and clear. We all need it. So we're going to continue to push through our avenues, and you guys hopefully can do the same.
Great, thank you for that. Yeah, it's really frustrating, and there may be discussion later on in the meeting about how to effectively advocate to make some of these get through this bottleneck, because things aren't happening. There is a question in the chat asking if someone could explain where the dam is in getting the vaccines out. Does the stockpile not have enough?
Hey, Jeff, this is Missy. I just tried to answer that in the chat as well.
Okay.
So that is correct. The Strategic National Stockpile does not have enough. Smallpox as a communicable disease in the United States was considered eradicated in 1972. Minimal amount of medical countermeasures was stored to counteract that particular viral illness. And when the current outbreak began to spread globally, the US leaned forward heavily to increase manufacturing and purchase additional doses, as did the European Union and multiple other nations. And the demand across the world has not been able to be kept pace with the manufacturing that is ongoing. So that's correct. The Strategic National Stockpile does not have enough to get out. So that's having to be prioritized for the most at-risk groups in the fashion that we're working with, for better or worse, clearly.
Great, thank you for that. Yeah, it's obviously very frustrating, as we could tell from all the comments and questions. So Terry posted Ventura Gay Pride last weekend had a Vax pop-up clinic, and these counties like Ventura and Santa Barbara are much smaller than Riverside. So the question is, why is our county unable to do what these smaller counties can do? And can we activate federal partners to break through the bottlenecks, as I was mentioning earlier? So I don't know who wants to take that one on.
Maybe
So,
go ahead.
I'll try, and then Dr. Shavinsky can certainly add on. I would say that Riverside County has been vaccinating individuals. We have been navigating post-exposure prophylaxis, and we have been working with partners to give out hundreds of doses of vaccine, both prior to and with the intradermal movement. We have also been working with venue hosts to bring on pop-up clinics leading into Pride events. And we have followed the channels that we have been told to request additional doses, and in some cases have received partial allotments from those requests, which have gone into the provider setup to not only to cover, and I should probably at this point, Jeff, and I'm sorry I didn't do this in my initial update, but I should share with the group that Jynneos vaccine is available through multiple partners throughout Riverside County that are working to support the community. Borrego Health, DAP Health, Desert Oasis Healthcare, Eisenhower Health, Kaiser, our Riverside University Health System, community health clinics in Corona, Moreno Valley, Palm Springs, soon to be Hemet, Riverside Medical Clinic. And we continue to work with providers also on this call to expand vaccine access to them as well to support. So I want to make sure that it's known that we are vaccinating. There are efforts going on. There are clinics rolling. There DAP Health hosted over the weekend. Borrego Health has hosted after hours clinics. Kaiser has popped up on the weekends. So I know that more access there, though, is needed. And we're continuing to try to expand that network of support as well as host pop-up events. So it is a multiple pronged approach in that regard. Dr. Stravinsky, please feel free to add.
I was just going to add that I think it really comes down to that we have a large population that is potentially at risk and that is very motivated in terms of healthy behaviors to try and get the vaccine, which is a positive thing. But what that means is that the doses that we have just does not match up with the number of people that we need to get the vaccine to. I think that's what it boils down to each time, is that, when we're pointing out some of the other, places that are able to do some level of vaccination, their situation may not be Aiken or may not be the same as ours, where we know that we just have such a large sex tourism industry. We know that we have a large population that is potentially at risk. And that the doses that we have is just not the same number to get everyone vaccinated and get them their primary and their secondary shot. And so I think that's what we're continuing to deal with.
Great. Yeah, thank you for that. I mean, it all boils down to, you're doing everything you can with what you've got. So we just need more. John, you had your hand up. Go ahead.
The situation with vaccine, it's sort of like the summer Palm Springs pool party scene. You can only go unless you're invited. and that's how getting vaccinated happens. It's who you know and who you're affiliated with, and it's invitation only. We don't have, when you say a pop-up clinic, it's a pop-up private party. It's not a pop-up make an appointment and show up because you've decided that you're at risk. There was a wonderful Facebook group that actually won some awards during the pandemic, early days of COVID, and when vaccinations were made available, called Vaxi. And it kind of dedicated itself to finding places where people could go to get vaccinated. We don't have anything like that. We only have a bunch of insular private, healthcare providers that are talking to their people that are in their system, and using criteria that is definitely fair, because they're at the most risk. But we don't have anything where people can decide that they're at risk and sign up and get a jab.
If I can add on to that, though, I think we do have some pathways, but it doesn't mean it's where it needs to be. So we have had some events at some of the sex clubs to try and that was through feedback from different partners on this call that helped us to get the information of who they knew that might be in the circles that might be in highest risk. Granted, that was still an invite only, but I think the second tier on top of that has been the vaccine interest form, where people have been signing up on that form, and we've literally been slotting them into vaccine appointments. So I think that's the closer side. But the reality is, we all know that ultimately the way that we're going to get the most people vaccinated is through larger pop-up events when we have the vaccine supply to do so, is the caveat. Right now, in the meantime, what CDC and CDPH is, the messaging that they're handing down is that if we have open events that are fully first come, first serve, that is unfortunately at face with equity, that we don't reach equity populations if we're not being more specific and intentional about who is, at the highest risk. So the answer is both. We want to be doing both, and we want to be increasingly moving towards open events as vaccine supply allows us to do so. But what you say is well taken. a number of the clinics and some of the events have been more invite only to try and reach those equity goals, but we've also tried to use the vaccine interest form to be able to provide an additional pathway for people to sign up and get the vaccine. But it's not enough. We need to keep moving and opening as we get the vaccine to do so.
Yeah, there are several comments coming up in the chat about that. So thank you for addressing that. And yeah, so you can check those out at your leisure. Tim, go ahead.
Hi, everyone. Yeah, I just wanted to, thank the Riverside County Health Department. I know you guys are really trying your best to get vaccines out there. I had to drive to LA for my first shot back on July 20th. And I put my name on a list with Eisenhower at the Rimrock location probably about a week ago for the second dose, but I never received a call back. So I went to the South LA walk-in clinic on Saturday, and the first one was the sub-Q method, and then I had the intradermal on Saturday, and I was in and out of there in an hour. So hopefully we will get some walk-in clinics going in Palm Springs in the very near future.
Yeah. And I know there's been some concern. I mean, this, as people are talking about, this is an equity issue, right? If you're not part of these closed systems, you don't really have access. And, we have the public vaccination form through the county, but that's obviously not addressing everyone's needs. So yeah, it's becoming kind of a social equity issue as well.
If I
yeah, go
add
ahead.
on that too, just in terms of the vaccine form, because one thing that we had recognized as well, that there might be some literacy challenges, or for older age, there might be a technical divide. So we've had staff help fill in the form for people by asking the questions, and also with helping with translation. So we've also set up that kind of opportunity too, to help people to sign up if they're having trouble with the form, then we just fill it out for them. So just to add that we've also incorporated that dimension to try and make sure that there's more access into that vaccine form as we can. So
Great. No, thank you. That's good to hear. And is the form now available in Spanish as well? I assume it is, but
It is, yes.
okay.
It is available in English and Spanish. And there's a button to toggle between the two based on internet display. And then our team does have the ability to support English and Spanish. And then we're expanding to work with additional CBO partners to make sure that there's flyers for the forms, and staff with our community-based organizations that can help their groups and advocacy channels get registered, or at least submit the form online as well.
So meaning like the promotoras that have the community health workers that have been very helpful throughout COVID, similarly are being contacted to help. So trusted messengers, engaging trusting messengers. So I think that's part of the challenge, is some of this stuff is happening a bit, I guess, so to say, behind the scenes, in terms of trying to make sure that there's multiple different ways that we're reaching out to different groups that are typically at a higher, concern or equity need, in addition to also making the more like public vaccine interest form and things like that. So it's a multi-pronged approach that still has its limitations, of course.
Yeah. Well, terrific. And there have been some questions in the chat about what's happening at various providers. Before we move on, I see Ima has her hand up. So go ahead, Ima.
Hi, thank you. Dr. Shafinsky, you mentioned that you have been starting to call some people who have expressed interest in the vaccine through the vaccine form. Do you have a rough number as to how many people you have been able to vaccinate with that form at this time?
I can answer that, Dr. Shafinsky. So we've received a little bit over 2,000 forms from community members expressing general interest. That takes out test forms and duplicated forms. And if I were to give the exact numbers, 2,437 deduplicated forms. And we have gone through those forms with our current priority groups, and we have made outreach attempts to 158 individuals. And we've been able to that meet the priority groups that are currently being vaccinated with the supply that we do have. And we have been able to, with those 158 outreach calls, confirm, at least as of an hour ago, 72 appointments that are happening this week, and 35 appointments that had previously happened.
Perfect. Thank you. That's an amazingly detailed answer. We appreciate that.
Thank you.
So, go ahead.
All right, I was gonna ask if I can give some of the other updates.
Yeah,
outside
go
of
ahead.
vaccine. Okay, so some of the other things, so last time, or at least on the provider call, we mentioned a resource list that talked about resources for people who are experiencing homelessness or difficulty with food. So that is up on our website. After I talk about these different resources, then I'll go back through, or if somebody wants to help me with putting them in the chat. So if I don't see there, then I'll fill them in, but that is on our website now. And so it's actually a pretty big repository of different kinds of resources, including some of the social needs related ones. And then I also wanted to provide information, if the city isn't on, just in case, that the Palm Springs wastewater testing, that has also gone live and is posted on their website as well. Yeah, so they only have 2 data points right now, and it's going to be updated, from my understanding, weekly. And so I did want to give some interpretation caveats on that. The most informative way for us to understand wastewater sampling is to look at trends over time. So a couple of data points might not tell us the story quite yet. It does, help to confirm that monkeypox is present in the community. That's not earth-shattering, we know that. But over time, it'll help us to see whether those might be elevating or going down over time as we monitor that. So I think that'll be a helpful tool for surveillance as well. And then I also wanted to point out some other resources. So CDPH, they have posted on their website a home guidance around isolation, which is helpful because that helps to break down what people should be doing around isolation when they do have MPX. So I'll put that in the chat after, and then some update on CDC guidance, and I'm going to provide a link. So CDC actually has now added a button on their website for any updates that are made to the website. And for me, that has been really helpful, because instead of trying to search through their pages to find what have they updated, what have they not, it just says, it gives a list of this is what was mostly updated most recently. And so then you can follow that to see some of the things that they've updated is guidance for schools and early care education centers. So that is helpful, guidance on congregate settings. And then they also have some new flyers, including they have one that's for youth. So I thought that one was helpful too. We'll provide that. And then I just wanted to discuss a couple of studies that recently came out. One is a MMWR, which is a CDC publication. And that one was looking at whether or not there's virus present on surfaces in a household of people that were experiencing MPX. And so in that household, they had been doing some regular cleaning throughout their illness. But what it showed is while there were viral particles that could be detected, it wasn't live virus. It couldn't be cultured. So that was helpful to provide evidence that with our regular cleaning, that it can help to prevent transmission from fomites, from objects, from physical objects. So that was helping to provide that picture. But I think, more studies need to be done on potential of spread from environmental objects. Fortunately, thus far in the current outbreak, we haven't seen that be a primary contributor in terms of the monkeypox cases or the MPX cases that we're seeing. That still remains to be more close skin to skin contact or prolonged face-to-face contact, not as much so seen from objects, though theoretically possible. But that was a helpful one to show that we're not seeing as much live virus if proper cleaning is being conducted. And then wanted to share, there was also on the CDC website, a study let me see if I can get that one up real quick. Looking at change in behaviors since the time of MPX outbreak and how that changed in select behaviors in gay, bisexual, and other men who have sex with men, and what steps they're taking. They call it to protect themselves and their partners from monkeypox. I wanted to point this out because I feel like sometimes the narrative or the information coming out is, you know, people aren't changing their behaviors, but this study actually shows otherwise. It's saying, and I think it's really helpful, it shows 48% within that group reduced number of sex partners, 50% reduced one-time sexual encounters, and 49% reported reduced sex with partners that they met on a dating app or sex venues. So I think we do see that partnering between vaccine and then also the harm reduction components of thinking about how to, you know, engage more safely in our own practices. I think we're seeing that both of those things are happening. And then I just also wanted to point out that, you know, from in terms of our canvassing efforts, we've received really positive interactions from the businesses that we've visited, from the different bars, clubs, all of those. You know, we really have seen a lot of people with interest around MPX and trying to learn, you know, either whether it's how to get a vaccine or where to get tested or treatment. It's been a very positive kind of partnership through those canvassing. And so I just want to make sure that it's clear that, you know, for anyone who's listening, or for wherever that goes, that we found that the Palm Springs and the greater Riverside County area, the people themselves are taking this seriously, and that that it does seem that there is, you know, behavior changes on a national, and it seems like potentially local level as well, due to, you know, what we're seeing with MPX. So I wanted to call out that study because then it actually has numbers to say, you know, both of those things are happening. And then it just also call out some things that are in process. So we have a guide that should be posted soon about how to avoid scarring with MPX. So more dermatological focused. And so for that one, it just basically goes over the number one thing of don't scratch. You know, if you scratch that area, it's itchy, it's painful, but if you scratch, then it has more opportunity for inflammation and more opportunity also for secondary infection. So it'll talk about that, about using petroleum type products to help soothe the skin. And then also, importantly, like if you're bathing or showering, you want to avoid any soaps that have a fragrance or a perfume associated, or any harsh laundry detergents, because those can further irritate the skin, especially when there's openings in it. So just to be careful about that. And then we have a guide on barbershops and hair salons. So that one will be coming out to you on how to properly clean materials and tapes and all of those sorts of things. So that'll be on the website soon as well. And I will pause. I know that was a lot, but it's bi-weekly, and I just want to make sure that you guys get the latest. So there it is.
Thank you. We appreciate the data dump. That's what these calls are for. So there was a question in the chat about dogs, and I think many of us saw the news reports about that Lancet study about the French couple who had MPX and their Italian Greyhound unfortunately got monkeypox. So has the CDC addressed this yet? Are we getting any guidance on what to look for and what to avoid?
So there are some pet guidance as well. I'll put that in the chat.
Great.
Yeah.
Yeah, I know a lot of us are pet parents and concerned about our fur babies, so it's important.
Thank you. My German Shepherd over here.
So somebody else posts, and then I want to move on to the provider updates. But it says, I certainly understand why places like CCBC are good to reach the at-risk population, but these aren't necessarily people from Riverside County or even California. They're visitors. And it feels like the older HIV positive population has kind of fallen to the bottom of the list, because we typically, as you were saying earlier, take good care of ourselves. But how do we assure that we, reach this population? Because particularly those with HIV are considered at higher risk. And so what are we doing to reach them?
Jeff, I'll try to
Okay.
tackle an answer, and then Dr. Shavinsky can add in, or others. So I would say CCBC has been the host. We have been driving people literally or figuratively to that venue as a host, and vaccinating the staff that work there to provide some protection but bringing in individuals from the outside, not necessarily the guests of CCBC, though there may be individuals who engage in transactional or survival sex that go there that we have vaccinated as well. And our partners have actively worked to engage their HIV positive patients that are at higher risk, and will continue to message with text messages, technology reach outs through phone, as well as their potential electronic health record outreach. And our RUHS EIP clinic is doing similar outreach to the patients they serve. And we have been also trying to work with AIDS Health Foundation and other partners, including this group, to maximize messaging and information sharing for the vaccine appointments, and then mitigation strategies, as Dr. Shavinsky was discussing. We're definitely open to additional strategies and communication methods. Perhaps there's another venue or maybe another place to post or share flyers or share information, and we're happy to continue to expand that outreach to make sure that the information is making it to the people who need to have it in the HIV arena, as well as others. So.
Great, thank you. And I know there's been concern, I think some of it posted here and in past meetings, that the venues, and obviously you're reaching the highest risk people, but there's some stigma associated with going to a sex venue to get vaccinated, or to Desert AIDS Project, because AIDS is their middle name. So for people who don't identify with that, or feel stigma, or the need to be more discreet, that's an issue. So I know during COVID, the city opened up the convention center here. During the week especially, it's generally not used. There's lots of space to physically distance, and they did both testing and vaccination events there. And I know in talking to city council members, they'd be happy to provide that. So I think when you do have larger numbers of vaccines for a larger space, that might be a good neutral location. I just wanted to kind of put that out there.
If I can add also that for those that we're pulling off the list, we're scheduling them in some of the RUHS clinics. So it's not necessarily in that venue. So that's one thing. And then I also want to clarify, because I think maybe we weren't as clear as what we meant when it said 100. So in the chat, I see somebody said 100 vaccines from a wait list of 2,400 is a failure. So to be clear, only around 100 of them met the current priority standard, like priority categorization. But as we move out from that priority categorization, then we'll be able to pull more people off that list. So when Misty was talking around the 100 some odd number, those meet the priority group currently. But as we move into broadening, there'll be more people, and we'll be able to pull more people off that list.
So yeah, thank you for clarifying that. So the criteria are based on the number of vaccines, or is it the state and CDC say you can now move to phase 4, or whatever group? So how does that work? Is it based on vaccine amount, or is it a more arbitrary?
So it's a little bit of both, Jeff. So CDC and CDPH provide guidance for who is at the highest risk based upon clinical data, clinical literature review, and known risk profiling across the nation. So we have interim clinical considerations from CDC that drive the populations that should be actively recruited to get vaccinated with, so actively outreached to. And then there are other groups who may express interest. And to add additional context to what Dr. Shavinsky is sharing, the 2,400 includes individuals from, I like to keep my vaccines up to date, this is available, I want it, I have no risk, to individuals who have the highest risk because they have multiple anonymous sex partners engaged in survival sex and are homeless. So there's a whole gamut there. And while we would certainly love to be able to vaccinate everyone who has even the slightest hint of interest to protect the community as a whole, we do have to maximize the resource that we have and get it to the people who need it the most first. And I know that that's a very controversial way to navigate pieces. And then I would also add with the vaccine interest form, we do have interest from the healthcare community at large as well, expressing interest in getting vaccinated. So we'll continue to navigate that in priority fashion as well with the population.
Great, thank you. And just, yeah, so the person muted, sorry about that. Not really fair to you. And then one last question before we move into the provider updates. Trying to do this for a while now, but this kind of related is, will the wastewater virus detection that just started impact vaccine eligibility if it shows that, you know, we have, it's going up and indicates that there's a lot in the community?
I can say I'm hoping that it can help provide additional justification. The more data points that we have, the more that we can then provide that back to the state in our justifications. So when we're asking for the additional doses, typically alongside that, we have to provide justification why we're asking for that. So we provide any events that we know coming up, any sex tourism venues that we know exist. We provide information about, you know, all of those different layers of risk that have been shared with us on this call, in addition to the data that any data that we might have. So it can just be another thing that we can add on in terms of, you know, look at this and you know, to consider us, you know, more highly for more doses. I think the tough part is we're all pulling from the same pot, is, you know, throughout California, throughout the country, and I guess not making a statement as to, you know, where it's just tough, because that's what it is. It's, you know, whether we're pulling out of it, or whether it's San Francisco pulling out of it, or whether it's, you know, somewhere else pulling out of it, it's one shared pot that we're pulling from.
Right. Yeah. Again, you guys are I'm at the bottom of the food chain there. You have to just kind of dispense what you receive. So I feel for you there. A couple of questions in the chat about LA, and as noted earlier, they have their own direct supply through CDC, so they're kind of a different entity. But it mentioned that they have been able to broaden their criteria. So is that a function of, you know, having enough vaccine to be able to do that, so they get to make that determination on their own?
Yes.
Exactly.
Yep. Exactly, Jeff. Exactly.
Great. Okay. Yeah, let's go on to because there are a lot of questions about, you know, what's happening in specific providers. So DAP, if you want to go, I think Trent Brodus is going to be the one providing that.
It's me, Trent Brodus. So let me find my readers. As of this morning, DAP, we vaccinated 1,000 people. For monkeypox, we have tested 116. Of those, 58 are positive, 26 results are still pending, and 32 of those were negative. 9 patients have received TPOX as treatment. Several others have received vaccine as treatment, and I don't have that number. For our monkeypox hotline, the number of calls that have been responded to is 1,120, which averages about 75 inquiries per day. That's the update from DAP. Thank you.
Great, thank you. So the one question I want to ask of all the providers is, what are you telling people about getting their second doses? If it's been 28 days.
We started today giving second doses. It's hard to believe that it's already been 4 weeks, that it's right. That it's already coming around again, that it's time for the second dose. I think we were hopeful by the time there was second doses, there would be many more, but we've started today at DAP.
Great, good to know. Thank you.
If I can share the guidance on second doses to help, I don't know if specifically, I don't want to speak for Trent in terms of, you know, who they've been vaccinated for second doses, but the guidance has been from the state that in terms of prioritizing second doses for people that have immunocompromised, so certainly HIV would fall into that. Those that are considered to be high risk in terms of immunocompromise. And then in addition, because PEP or post-exposure prophylaxis is prioritized, we're also doing second doses for post-exposure, because certainly we wouldn't want somebody, if we can catch them early enough with the vaccine after they've been exposed, we wouldn't, you know, we would want to try the best that we could to help them either avoid or lessen their illness with MPX. So those have been the groups that we've been providing second vaccines to.
Yes, and we're following your guidelines.
Terrific. Thank you for that. Good to know. And before we move on, I just want to direct people to the comment from Kim Sarawatati about LA County and how many doses have been allocated to LA County versus the state of California. So LA got 49,000 while the entire state got 75,000. So I think that gives us a sense of why they're able to do what they're doing and why the rest of the state is struggling. So yeah, more on that later. So is there anyone on from Borrego? Looking through to see if I see anyone. If not, Eisenhower, would you like to provide data on what's happening on the ground with you guys?
Am I the only person, Jeff?
Yeah, I think so. Go ahead, Dr.
If
Stapleton.
I'm going
Thank you.
to think I actually live in my car, it is not the case. I do have a home. But I am again speaking from the car. And I'll just preface this by saying I did not ask permission from above my pay grade to give out numbers, so I'll be a bit vague, but we have, I think, around 60 positive cases so far of testing. We've given out in the high hundreds of vaccines. We just got a pretty big allocation. We'll do our first Saturday clinic, I believe, next Saturday. One troubling aspect for me, as a former public servant for 30 years, is that equity and it's all by invitation, as has been mentioned. So the only thing I can give as advice is being a squeaky wheel. If you do have a connection, and just letting us know, because it's hard to even respond to requests with an invitation only. There has to be somebody to give the invitation, and we're busy giving out TPOCs as well. That is going about as well as can be expected. We're getting a lot of help from the county. We would like to express our appreciation for that. So that's all I have to say.
You're welcome, Ann. That has been a big lift, but we're happy to help where we can.
Yeah, speaking of TPOCs, do you want to kind of give an overview of kind of how that's working right now? So who all, I know Borrego, the pharmacy there, has been able to provide it. Is there anyone else in the county, or is it all going, the rest of it going through you?
I'll step in here and help out with some context. Jeff, it's Misty. TPOCs is currently in oral form with DAP Health, Borrego Health. We support Eisenhower Health, as Dr. Stapleton just highlighted. And we also have TPOCs with Kaiser supporting their Coachella Valley operations. They have a small contingent set aside in Riverside for cases in that area. TPOCs is also with Riverside Medical Clinic. And we have been working with our CHCs and our EIP clinic and any other partner who needs it emergently through the medical mutual aid system to deploy it. And we just finalized paperwork to be a TPOCs provider to support the community with Desert Regional Medical Center in Palm Springs. And they partner heavily with DAP Health for ongoing monitoring and support, which is a great relationship. And we have TPOCs with Desert Oasis Healthcare as well.
Terrific, thank you. And I see Dr. Karkar from both DAP and DRMC. So go ahead if you have a comment or question.
Thank you, Jeff. Thank you, Misty and Dr. Shabinsky. Yeah, we just started IV TPOCs on a patient recently, and really appreciate that he couldn't take oral. But hopefully within the next day or so, he would be able to, able to take oral medicine. We really think everything came together very quickly. So thank you for helping.
No, thank you for sharing that. And so I'm assuming that's because the patient had lesions in their mouth or throat.
Yes.
Yeah, which is one of the really
And there was dehydration, kind of a lot of systemic symptoms, headache, high fever, kind of worrisome for involvement, invasive disease, etc.
Yeah, I think especially in sexually transmitted cases, we're seeing a lot of that, and rectal or anal disease and penile disease as well, which is can imagine it's got to be excruciatingly painful. So thank you for that. Any other providers? Anyone from Desert Oasis? Or Borrego? And I know Dr. Ritchie is on if you want to talk about what you're seeing on the ground there at PS Healthy Test.
I mean, what we're getting is a bunch of patients that are actually sending in pictures and asking us if they have monkeypox. They're just not coming in to get tested really. And quite frankly, a lot of them look like MPX. And, I tell them it looks like it could, come in and get tested, but they just don't want to. And I tell them to isolate and they stay isolated. And then again, we get a lot of patients. We have a whole list of patients that want to get vaccinated. We're having a problem with your care system. I mean, that's just a fact. Our EHR doesn't align with your cares. It's a cloud-based system. So, I mean, again, if we're in, quote unquote, an emergency with monkeypox, I mean, can we do something about that so we can at least get, I mean, it's just, I sound like a broken record, but it's just unfair. It's completely unfair that we're getting calls from people that aren't affiliated with DAP, aren't affiliated with Borrego. And I know I've been on almost every single one of these calls except for one. And I know, Dr. Chavinsky, that you and Misty said that for sure the institutions that are getting these vaccines will share. And I understand they have a lot of their own patients, but they're not sharing. And so is there a way to bypass this CARES until we can somehow,
So
I don't understand it. I mean, Mr. Matt Moran, who's way more technologically advanced than I am, he says, he's working on it diligently, but I mean, really, I mean, making someone go into LA to get a vaccine, basically, with all the road rage on the highway, it's just, I mean, I don't know. I just don't know what to say anymore.
if I can comment a couple things, and one is a question, one is a comment. The one thing is about the CARES is we don't have as much flexibility on that. Providers need to be on CARES. I know we've worked on assisting, but that there's some internal systems on your EHR system that makes it more challenging. What I would, I guess, suggest is if you can encourage your patients to sign up on the vaccine interest form, we are moving people off of that. And the second part that I had a question about is for those that are sending you pictures, I guess I don't want to put you on the spot, but so instead of asking if you are, I will request, please report those to the county. So that way we can still have those numbers, even if they don't test, because that's the kind of thing that can influence our vaccine doses. If there are people that are sending in pictures, but we don't have it reported, and I guess I would encourage you to tell them that as well, because that might be something that matters to them in terms of getting vaccine out to their friends and the wider community. Is if we don't have those cases reported, then they don't end up in the systems that help the state determine whether or not we're getting more vaccines. So the request would be to report those to us, even if we don't have labs yet, so we can have them as suspect cases, we can follow up with them and we can do the contact investigation. But then to potentially also maybe add that point to them for them to know that if they don't get tested, there is potentially an effect on them, but also an effect on the community. And so that is a further reason, hopefully to get tested.
Yeah, I mean, I totally hear what you're saying. It's just that a lot of they're all sending them. I have no idea who they are. They're sending them to our email. I seriously have except for email, I have no way of knowing who they are, and I try to help them as best.
You can send the email even, or any information that you have. If you have a name, if you have anything, our teams are equipped to follow up and do conduct investigation. But it's exactly tips like that. I know you're embedded in the community, and a lot of people also trust you and the testing and all of that. So that can be an opportunity for us to make sure that there aren't outbreaks, and make sure that we're actively following up on each of those, so we can help offload on that part, and try and do some of the legwork there.
Okay.
And then I know, just to pick up on what Dr. Ritchie has been saying over the last month or so is about getting sites like hers accredited to be vaccination sites as well. Kind of how's that happening for, we have kind of the big 4 or 5 right now, but how about other smaller clinics like hers?
And Jeff?
Yeah.
Let me just throw my 2 cents in. It's not so much the incompatibility of the system, it's the human element that's really slowed it down. The banter between parties, the slowness in implementing and testing the H7 protocol. This could have been done very quickly. It's not the mechanics or the computers, it's the humans.
So when you say the humans, can you clarify what you mean? Because I know our team has been very accessible to help with care.
Your
So-
team has been very accessible. In the beginning, there was some confusion about who to actually be point of contact, to California or Riverside. There was 2 like-named individuals, and we were talking to the wrong one. We didn't know there was 2 people with the same name. And then if Bismatics and the California team would talk, I bet they could iron out whatever needed to be tested quicker than it is now, because they send an email to us, we go to Bismatics, back from Bismatics to us, and it's like a ping pong ball.
Can you describe what Bismatics is for the rest of us?
Bismatics is our vendor for the EHR.
Okay, so thank you. Kim, I see your hand up. Did you want to address this?
Yeah, just a comment. And I think that Misty mentioned this early on in her, when she gave an update. So the way that CDC and CDPH are looking at allocations are that 90% of doses have been administered, right? So the only way we can demonstrate that is by doses being in care. And so that's part of the challenge that we have. And Dr. Ritchie and Matt, I would just offer that I know it's extra work, but the data can be entered manually until the interface is linked up. So if you're willing to do that, then we can move the process along as a short-term fix. I know that's extra work, but just want to point that out, that is an option.
I'll contact somebody tomorrow about that, because we'd be more than willing to go that direction right now.
Great, thank you. Dr. Ritchie.
Yeah, I mean, we didn't know that was an option. So maybe that's what Matt meant by the human factor. It's just that, I mean, we're a year-old clinic, so this is all new stuff to us.
Sure.
It's not new to anybody else. But we didn't, when I offered to partner to vaccinate in early June, didn't even know I had to be part of care. So it's just a lot of miscommunication. But listen, we enter for Leo. So if we enter for Leo, we certainly, I think, can handle the cures thing.
Perfect. We'll
manually.
loop back with you, Dr. Ritchie.
Okay, sounds great. Thank you.
Then there is a question in the chat about they don't quite understand why people that have already gotten the first dose of the vaccine are getting second doses when so many people have not gotten their first doses. So
I think that's exactly the balance that CDPH and CDC are trying to advocate for in terms of prioritizing the first doses. And the reason why some people are getting the second doses, particularly those that are immunocompromised, the thought behind that is they may not get the full benefit from the first dose. Their immune system isn't strong enough to be able to have as much of a response to have the protection. So the thought is by getting them that second dose, they might have something that's not as high of a, of an immune reaction or ability to fight it off. And so that's the reason. It's knowing that those are immunocompromised, their body might not have as much of that protection from one dose alone, that the 2 doses might get them closer to the, 1 dose or plus area. And then also for the PEP, the reason is that, and this is the highest risk group. This is somebody that's been a high risk exposure. This is somebody that's on the cusp that could develop MPX. So of course, for somebody that's been exposed to somebody who has monkeypox, and we know they had close skin to skin contact, that's exactly the, the moment where we have to move. So that's why. So it's the balance. We want to make sure that people are getting first doses, but we're also trying to cover our highest risk that we know has been exposed, as well as those that are immunocompromised.
Great, thank you. And then for those who've gotten their first doses and aren't immunocompromised, can you provide some statistics on what their coverage is and how long it takes to reach that level of coverage before they're able to get their second dose? I know the numbers are a little squishy, but if you could provide some context for that, because people are naturally concerned, and be helpful too.
Well, it's tough because the studies have not been focused on those that got their first dose alone, and there's a variation based off of human factors as well, and immune status. But I would say is that you don't have the level of protection that is considered to be complete until after the second dose and 2 weeks. So and this strategy has also been used in the past, unfortunately, for other times when there's been vaccine shortages, where the idea is if we have enough of the community that has had a first dose of whatever vaccine that is, that we start to get some level of ring immunity around. But it's not the ideal. That's the whole, I think, thing about it is, we switch to intradermal, and at times we're feeling like, there's more vaccine or less vaccine, but the reality is it's a shortage situation. And that means that we're having to choose, and that means that people aren't getting the full protection right now. And so that's the whole part of, it trickles back to, we need to get more vaccines. So we're working to do that. Part of that helps drive that is making sure that we, one, have all the vaccine reports in care, which is why we're, being, strict about making sure that somebody can enter into care, because if those doses aren't recorded, then that means we're not going to get more doses. And then second, in terms of reporting, so if somebody thinks that somebody might have MPX, a healthcare provider, they report to us, then we can enter it into our dashboard, enter it into our numbers. And that's, again, what California CDPH looks at to determine our doses. So I think we all kind of have a role or a slice that we could take off here to help with trying to increase those numbers.
No, thank you. And I appreciate that. And the reason I was asking is just so people realize that after they get that first dose, they're not fully protected, and need to kind of take that into account when they think about, what they're going to do, behavior wise. So thank you for that. Dr. Kirkar has a question. Go ahead.
So the question I had was, what's the longest duration beyond 28 days to say that, hey, everybody who got the first dose are not protected until the second dose, but what can be the longest duration between the first and the second dose, regardless of, the status of immunity or, risk factors, etc.
So I can answer some information on that. The recommended additional time interval above. So when we're talking about the 28 days plus, so 4 days before, 7 days after is the window. And Misty, I'm sure, will correct me if I'm wrong on that, but that's what I believe it is 4 days before, 7 days after. But in the CDC guidance currently, they're saying if it's been longer than that, you don't have to repeat the series. And I know that's been a concern of some people too, is if I don't get into my window, does that mean I have to repeat it? Does that mean it was for naught, that it didn't do anything? Right now they're saying that that you wouldn't have to repeat the series, but that you would get that vaccine at the soonest opportunity that we would have to be able to provide a second dose. Missy, was that accurate?
Yep, you got it exactly.
Great, thank you. So I don't see any other questions. CJ Toby just joined. So if he wants to add anything to it.
I was gonna say there was a question earlier or up that I think we missed. It was a question about safety around the gym, I think.
Oh, yes.
Like, can we go to let me go scroll back. I think I saw that one. And so I think it was something on, how safe is it to go to a gym? And so what I would suggest, or right now, what we're understanding, and I think the household study that I mentioned helps to inform that, is that one, we're not seeing surfaces as a primary way of MPX being spread, but two, the importance of cleaning. So for instance, cleaning the workout materials, workout mats, etc. Cleaning them, disinfecting them in between uses can help, and washing your hands frequently. So those are things that you can do to help with minimizing the spread. And of course, similar to any kind of spreadable infectious disease, gyms themselves should be, engaging in the routine disinfection practices. So that's what I wanted to add.
Yeah, I mean, I think a lot of people when they work out wear workout gloves, so that might be an added
Even
layer.
better.
Yeah. And it's summertime, so long pants and long sleeves may not be all that popular, but it's another thing as well. So did anyone else, we're about 20 minutes after, we got 10 minutes left. Anyone else have any questions or comments they wanted to share with the group? There were some questions about, how do we advocate? And I know we had some pointed questions for the California Department of Public Health, because they're one of the gatekeepers in terms of vaccine supply. But we should know that a lot of our public health, our elected officials have been advocating on behalf of Palm Springs and getting more vaccines here. And there was some talk about how we might have to cancel Pride, which is kind of a nuclear option. But I think it's important to put out there that we learned from the HIV pandemic that didn't work. We actually lost an opportunity to engage people. What better place? We're doing it now with the vaccine clinics like CCBC, but if we did that, we would lose people. And now, different from the 1980s and 1990s, everybody's online. You don't need to go to a bar or sex club to hook up. People can just as easily find sex. And if we cancel Pride, all those people who bought plane tickets and hotel rooms are still going to come. They're still going to have a vacation in Palm Springs, whether their events or not. And if they don't have events to go to, many of those will be getting online and hooking up. So we could actually, that could have a backfire on us and could have more transmission as a result, because, going to a festival or watching a parade isn't going to put you at much risk, but certainly hooking up online, if we don't have those events, could do so. So I wanted to put that out as a food for thought if that comes up in discussions, because it wouldn't work and obviously would be very unpopular and cost the city millions of dollars in lost revenue for the businesses here. So I'm gonna throw that out there. Any other comments or questions? Parting thoughts? If not, I want to thank everyone for coming, especially our hardworking public health officials. I know these calls make for a very long day, and you guys are working really hard, and we appreciate all that you do. And we'll do whatever we can to support you, including some advocacy work. So I'll be sending out to this list some information on that in the next day or so. Maybe a sign-on letter to the appropriate officials, so we can maybe move the needle on this a little bit further. So thank you all. Again, this was recorded and will be posted on our YouTube channel in the next few days. So you can share that with those who couldn't make it. And these meetings will continue to happen every 2 weeks, with the exception of September 6th, because that's the date of our Positive Life program, which will be on addiction issues and long-term survivors. And then we'll resume our twice weekly schedule. And then providers and public health officials continue to have their own task force meetings every week. So keep each other up to date on what's happening as things continue to evolve so quickly. So thank you all for your participation, and we'll see you next time.